Plumbing. If water runs through it, we do it. Stop by one of the newly renovated showrooms in Hernando or Wildwood, or call today, 237-2888. That's 237-2888.
Mike Scott.
Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. Thank you for tuning in. If you've ever known anybody that was pregnant and then she gave birth prematurely, you know the touch and go circumstances that actually presents to the baby and to the new parents. And the March of Dimes has been really one of those organizations that has really helped to try to figure out what we can do to make sure that doesn't happen as much as it maybe once did. Dr. Edward R.B. McCabe is on the phone. He is a pediatrician, a geneticist. He's the senior vice president and chief medical officer for the March of Dimes Foundation. And he's on the phone right now to talk to us about the premature birth report card, where the United States is doing well and where we are lacking in the preterm birth rate. So let's find out about this important topic from Dr. McCabe. Good morning, sir. How are you?
Good morning. How are you?
I'm okay. Where are you calling from?
Calling from Westchester County, New York, White Plains.
All right. Well, thank you for being on the air with us this morning.
Well, it's a pleasure to be here, Larry.
I actually knew, I knew a young lady when I was a young man, and her father said, when she was born, I could hold her in my hand. That's how small she was. She was a premature baby, and she was healthy at this point, and she was an adult, 20-something years old at that time. But they don't all premature birth stories don't end happy, do they?
No, it's great that your friend had such a wonderful outcome, and I think we all know of those miracle babies. We don't hear as much about the babies who have chronic lung disease for their whole life, have learning problems or other disabilities, including cerebral palsy. So premature birth is an important issue in this country. It's the leading cause of mortality in the first 12 months of life in the U.S., and it's important that we keep track of how the U.S. and Florida are doing.
Do we have ways of knowing how to prevent it? Does it have to do with nutrition on the mother's part or anything at all?
One of the biggest predictors of a future preterm birth is having had another baby born preterm, and there's a medication that woman can take in her next pregnancy to help reduce the risk of preterm birth. We know that smoking increases preterm birth, as does drinking alcohol, taking drugs, so that we know that there are things that women can do. Unfortunately, half of all premature babies, we don't know what caused that preterm birth, and we're doing research at the March of Dimes in 5 prematurity research centers so we can get a better understanding of what causes premature birth and then reduce the risk for women by managing the outcomes even better.
Is it because there are so many undetected diseases these days? I mean, Zika was all of a sudden here, and we had never heard of that word Zika before.
Yeah, Zika is certainly a huge impact on pregnancy. We haven't seen it associated with premature birth. It's certainly associated with stillbirth and pregnancy loss, but we've been monitoring that very closely. We haven't seen that associated with premature birth, but we know other disorders, obesity and overweight, and type 2 diabetes can lead to preterm birth.
Why is it that some countries seem to have different report cards, using the term in my notes here? Why do some countries have different report cards regarding preemies than others?
We don't know that. We're trying to figure that out. Some have better prenatal care, better access to prenatal care than we do in the U.S., and we know that that's important. But it's one of the things we're studying to try and figure out why does the U.S. do so poorly among high development countries compared to other countries.
Wow.
The U.S., we have a rate of 9.6%. Preterm birth in the U.S. Florida is at 10%. Both Florida and the U.S. got a C, and many countries are at 5.5%. So there's something we need to be doing better for all of the pregnancies in our country for the sake of the babies.
If you broke down our country into different demographics, I don't mean necessarily states and cities, but like maybe cultures, or income. Do people who have better health care have better outcomes for their pregnancies, that kind of thing?
Yes, we do see that certainly access to better medical care improves it, but we see differences among racial and ethnic groups. For example, in Florida, the preterm birth rate among black women is 46% higher than the rate among all other women in the U.S. overall. It's also at 48%. We see just in Florida that it ranges from 9.3% in Palm Beach County to 11.2% in Duval County, if we look at counties where most of the babies are being born. So there are differences that we don't fully understand, but we are definitely working on.
Is all of the research done within the United States, or are our researchers working with researchers in other countries?
Well, certainly our researchers in the U.S. are working with other researchers in other countries. The 5 prematurity research centers that I mentioned, those are all in the U.S.
Does the March of Dimes offer anything for a lady who's pregnant right now, maybe listening to this? We don't want to scare them, but if they wanted information, would the March of Dimes be a resource for that information?
Yes, I would suggest that they go to marchofdimes.org/report card if they want more details on the report cards, or marchofdimes.org for information on healthy pregnancies and healthy babies.
And are there some times when there are some kind of informities or something shown to the doctor while the baby's in the womb, and then surgery is done while the baby's in the womb to keep the baby from becoming premature?
There are associations between certain birth defects and premature birth. There is the area of surgery in the womb, referred to as fetal surgery, that is increasing in the U.S. It's not available in every university or every state at this time, but there is a lot of work going on in that area. Whether it decreases preterm birth is unclear, because in fact there's a higher risk when you're entering the womb to do the surgery that pregnancy may be go into spontaneous preterm birth, but it is an area of research. I can tell you also that Florida is really addressing this. We just worked with leaders in Florida on a prematurity summit just a week or so ago to create localized action plans to reduce preterm birth in communities around the state. And they're also working on a program to reduce smoking, and we saw an 11% reduction in smoking among pregnant women who completed that curriculum in the first year. So your state is very active doing the right things for women and children.
That's good to know. If you are okay with taking a phone call, I do have somebody calling in.
Sure.
Are you okay with that? Dr. Edward McCabe is our guest. Good morning. You're on there with Dr. McCabe.
Good morning. I just want to know if the gentleman has heard of Shands Hospital. Shands, they delivered my child. She was like 2 pounds, 9 ounces, 3 months premature, and they did a wonderful job.
Oh my gosh. Thank God.
Okay. Could you hear him, Doctor?
Yes. And
there might be an echo right now. I'm trying to control that. Can you go ahead? And, if you're still on the line, sir, I'm going to lower yours so that the doctor doesn't get that echo. Doctor, did you want to respond to that?
Well, I just wanted to say I'm extremely pleased that everything went so well, and that was certainly a tiny baby. We occasionally see them even tinier, and I'm glad it works out so well for that family.
Yeah. Thank you for the call, sir.
Have you heard of Shands?
Have you heard of Shands?
Oh, yeah. Shands is an excellent hospital.
They got to be rated up there for premature babies. They did a great job.
Well,
Thank you.
That is really good news. Thank you for sharing that. And I apologize for the echo. I'm
Makes
not
you
really
wanna
sure
cry.
what the heck is going on. Oh, that is a beautiful
I know.
story. Doctor, real quick, if I could squeeze in one last question. As a pediatrician and as the chief medical officer for the March of Dimes, do moms who don't have enough money, can they tap into the March of Dimes to help them if they need it, financially speaking?
We help communities. We have community grants that are intended to reduce preterm birth in those communities. But certainly they should contact the March of Dimes. There's Ask Us at the March of Dimes, where families, anyone can write an email to us with their questions. We'll be happy to answer their questions. And if they want to get involved with the March of Dimes, please contact our local offices and work with the March of Dimes as a volunteer.
Okay. And as far as the report card, the website is marchofdimes.org/report card, correct?
Yes, that's correct, Larry.
All right. Dr. Edward McCabe, thank you so much for being on the air with us today.
Well, thank you for having me.
We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. On this Friday, intervals of clouds and sunshine. A warm but humid day, high 82 to 86. Partly cloudy Friday night. There may be a shower in spots along the coast. The low 61 inland, 68 at the coast. For Saturday, times of sun and